I know there's no such thing as
Jenny, no, you're standing out there, don't you?
We've got a pensioner here, we've got people from the Labour Party, people from Unite, people from Unison, from the different unions who's going to speak. So who's going to kick it off? Doris, from the pensioners, would you like to speak first?
Well done, everybody.
Hang on, you have to hold
sorry.
that.
Oh, I have to hold that bit.
Do you want me to hold it for you? Do you want?
Is that it?
Yeah, that's it.
That's it, okay. Yes, I'm from Lewisham Pensioners Forum, and as you know, we've been a really solid supporter of the campaign to save the hospital. We're now, and we have done for the past 5 years, been meeting to try and save the NHS. And this is why I'm here today. You people that work in the NHS, you're keeping it going, and thank goodness for that. Particularly as an older person, I find I'm needing you more than ever than I used to use when I was younger. But to get back to the nub of the matter, the NHS is in dire trouble, isn't it? It's about to be privatised. It's creeping all the time, and this is something that we older people do not want. We were around before 1948 when the NHS came in. We knew what it was like not to be able to afford the doctor, not to be able to go into hospital to be treated. And so we need to hang on to what we built in 1948. And I'm pleased to see a lot of younger people actually coming to terms with fighting to keep the NHS. Very often the younger people don't realise what it was like before. And so it's up to us to tell them, look, it was bally awful before the NHS came in. People, we're living longer, thanks to you, thanks to the care that we're getting from you, and we want to keep you, and we would, in the Pensioners Forum, we would do our best to support everything to keep the NHS going. But thank you, you younger people coming out in defence of the NHS. Thank you very, very much.
We've now got Joss Bell, who's from the Save Lewisham Hospital campaign, and she's a member of the Labour Party as well. Yeah? Yeah.
Hi everybody, I'm also chair of the Socialist Health Association London branch. I have been looking at this solidly now for 4 years, ever since we first set up Lewisham SOS NHS through the local Labour Party for Lewisham Deptford. And then we could see that the Health and Social Care Bill was going to be a complete and utter disaster. I wrote something about it. It's up on the internet. It's called Breaking the NHS Through Reckless Reforms. And sadly, all the things that I wrote about in there, where I referred to debates in the House of Commons and the House of Lords, and what was in the bill and what Lansley was saying, what Pedrada said, what the Royal Colleges said, everything in that has actually come to pass in such a frighteningly short space of time. It's like we've given a classroom of children masses of boxes of Lego and said build something fantastic, and they've taken a whole school term to build this wonderful thing, and they've gone, wow, look at that, there's still bits we'd like to do to it, but look at that, isn't that brilliant? And then another class of kids have come in and gone, oh, we don't like that, and they've run all over it and smashed it up in the space of 10 minutes. And that is the speed of which we're facing. And in the middle of it, of course, we had the Save Lewisham Hospital campaign, because we knew Jeremy Hunt was doing this to us for, yes, political reasons. He picked on Lewisham because it's a strong Labour borough. He didn't pick on Paul where my mum lives. That's very Tory. He picked on us. And we had to fight, and we fought, and not once but twice we defeated them in the courts. Now we've got the focus on what happens next. You'll see I'm wearing the Save Charing Cross and Hammersmith Hospital t-shirt. I don't know if you know, over there they've got an actually even worse they've closed Hammersmith A&E, they've closed Central Middlesex A&E, with the result, despite them being told over and over again in advance that it will make things worse, that the waiting times over in North West London are the patients in West London and North West London to go. This is a state now. They were told. So there's apparently some urgent review going on inside NHS England, so whether there will be any change, but certainly Charing Cross Hospital should not be subject to this.
You know, the workers in Queen Elizabeth Hospital that have been privatised are on the minimum wage. They're doing the same jobs, but now they're being degraded through privatisation, and they're working on the minimum wage. So full solidarity to them as well. And just to finish by saying that our campaign says that all NHS staff should get a decent wage for a full day's work, and also that no privatisation in the NHS, and we're doing our utmost to support staff in fighting those things. Thank you.
It's my first time doing this. I've just been training to become a union rep with Unison. The main reason I've done it's not just for myself and not just for a 1% pay rise, although that would help, is because there's a general dissatisfaction where I work amongst all staff at all levels. And like the previous speakers have been saying, there's an expectation that that the NHS will keep running on very little with no pay rises, and that we'll just put up with it. So I felt that I needed to do something, which is why I've joined to become a steward. But the other thing is, I think that the media especially forget about the unqualified stuff, the non-nursing staff, the people that are doing cleaning, admin. And I know that where I work, they've been pushed around and treated really badly, not valued, I think because they're not seen as professionals, in inverted commas, but they are professionals, they're very valuable. I know that they mean a lot to our team, and without them I don't think we could run things as we do. So I'm not just out for myself or my pay rise, it's for all of the staff that haven't come out today but probably will do in the future if I sort of get them going. But it's really just to sort of say that I'm glad that I've come out, and even though it wasn't the biggest, picket line, it's still a really good positive thing, so thank you.
Cleaners are the first defence in the health service, and yet all through my life cleaners have been treated as though they're non-entities, and it really, really makes me angry, because without cleaners you can't get past the door, because you can't open a hospital. Then you need obviously porters, nurses, so on. You're worth everything to us, because if you're not there, we are not there, and unfortunately our families will not be there. You know that. So keep thinking how good you are and how much better you are than any of those self-seeking individuals up at Westminster. Keep going, please.
And I think you must value the staff. If you're going to look after the patients, care for the patients, and Hunt is always talking about patients, it's all lip service. If you're going to value the patients, you have to look after the staff so that they are able to look after the patients. It's quite simple. So therefore I stand by the staff. I say thank you very much. As somebody was saying, it isn't just the doctors and the nurses, brilliant as they are, it's the healthcare assistants, the physios, the radiographers, the scanners, absolutely everybody, the cleaners. My mum, I have to say my mother was a cleaner. The cleaners I utterly appreciate. They're fantastic, and the hospital wouldn't be running without them. So thank you very much, and as long as you're fighting, I'm going to come here and stand by you. Thank you.
Thank you, Carol. It is so fantastic that we've come out for a second, 4-hour strike this morning, and I think the picket line has been very good. The picket lines will be good around the country. We get a lot of publicity, which is excellent. But I think if we want to win our strike, and this is not just about the 1%, even though we deserve 1%, we deserve much more. If the MPs can give themselves 10%, then we certainly deserve more than 1%. it is about, as we're saying, about saving the health service, and we can see what's happening with the running down of public services, with the running down of our hospitals and our community NHS services, and the privatisation, sort of a creeping privatisation that I think will start to turn into a tsunami, where services will be hived off. You know, Virgin Healthcare, Serco, Care UK, CRI, these awful private companies who are like vultures feeding off the living body of the NHS. And, you know, we wholeheartedly must support Care UK strikers who've been out on strike, you know, for over 3 months, you know, of concerted strike action, periods of strike action, where, you know, they were in the NHS and then they were hived off to the private sector, to Care UK. We're threatened with losing £5 grand a year, etc. They went out for a whole week of strike action. That didn't win it, but what won the strike was that they then balloted to go out for 10 days of strike action. As soon as the management knew that they were going to go out for 10 days, that won the strike. I think we need to keep this up. I think we need to go back to our colleagues and say that this has been a successful day today, and that there should be strikes continuing into the new year.
The argument that we hear on mainstream media all the time, that actually, you know, we can't afford a pay rise, and actually really we can't afford the NHS. Some people even say that private companies will invest in the NHS. We know that they all actually bleed the NHS dry of money. But the reason that's given, one of the reasons is you know, immigrants, as Maggie has just said, but the other main reason that's given is that people are too old and people are living too long. You know, if only we didn't have to look after the elderly, the NHS would be just fine. The fact that people are getting older is a great testament to the NHS and to the healthcare that people receive.